So today's speaker is Dr. Linda Larkey. She's conducted a range of funded research on multiple intervention approaches to promote cancer screenings in multiple clinic and community settings. She's a professor at Arizona State University in the College of Nursing and Health Innovation. Her more recently funded project explores biopsychosocial effects of Qigong and Tai Chi on breast cancer survivors' fatigue, cognitive function, and other symptoms, as well as biomarker assessments, including cortisol and inflammatory cytokines. So, Dr. Larkey, thank you so much for taking the time today to present in the director's webinar, and I'll turn it over to you.
Thank you so much for that introduction. I'm appreciating that you've mentioned my other body of research, which has been going on for many more years. About 25 years I've been involved in projects that are more focused on health communication, and the focus has been working with underserved populations, mostly here in Arizona, and looking at ways to reach our primarily the Latino population with messages around cancer prevention and screening. And for me, the experience has been always one of learning from the folks that we work with and learning from the promotores who do the outreach, and then also developing ideas around some of the things that we've watched them do, like the work that I've done for many years now with storytelling. But in that work, I had an opportunity to do a lot of promotion around physical activity, and although my background is more as a behavioral researcher in health communication, I started getting really a lot more colleagues around me who were experts in physical activity and exercise, and began to understand more about how we might look at the effects of those things as opposed to just how to get people to do those things. A number of years ago, I became interested in breast cancer and the issues that surrounded those who were survivors of breast cancer, and not just focused on the prevention side. And in that, I was learning that survivors still have a number of very persistent symptoms. For fatigue, up to 33 to 37% persisted up to 10 years in their experience of severe fatigue, and then other symptoms like depression, anxiety, sleep disruption, cognitive impairment, weight gain, and then just the simple factor of having all of these symptoms often created even more inactivity that added to the problem. So a lot of the work that was being done back when I was first interested in this was with physical activity, and it seemed like a hurdle to get over. A lot of programs did a great job in the research world of getting women signed up to do studies and getting them to progressively start with small incremental work towards physical activity, but there were many that just felt like they were so exhausted it was hard to even imagine joining a study where they were being asked to be physically active or to exercise. And so that's what got me interested in taking this work with Qigong and Tai Chi and bringing it into this arena. At that point, there wasn't a lot going on with breast cancer survivors in there. Maybe a little bit of yoga work had started, but not much with this much more gentle version of exercise. So I met a director, founder of an institute called the Institute of Integral Qigong and Tai Chi, and Roger Yanka was very interested in getting involved in research, and I was very involved in getting involved more with the Qigong world. I had already done, by the time I met Roger Yanka, I had already done one very small study with a Qigong master that was interested in doing research here in Arizona, and instead we worked with blood pressure as one of the easiest targets and did a small study on that in 2002. But by about 2003, I was more interested in moving back into the arena of cancer, and got involved with a lot of conversations with Dr. Yanka, and I would entertain how we might frame research. And our first job was to go back and do a comprehensive review of the health benefits of Qigong and Tai Chi. At that point, we saw 66 individual, unique, randomized control trials. There were some more studies that were published out of those 66 studies, but we saw a lot of different outcomes that were being evaluated. Even though the reputation for Tai Chi at that point was for falls and balance, you know, old people do this and they do it for falls and balance, we saw that even at that point there were a lot more studies that were being examined. At this point, there's over 180 randomized control trials out there, so I would never try to do such a review again. But we got a lot of interest in this particular study and even did a webinar on it way back around 2011. And so in my interest around this issue, I felt like a lot of these different outcomes that were being looked at and some being shown to be effective were relevant to breast cancer survivors. So let me backtrack a little bit and give you some definitions here. What is Qigong and what is Tai Chi? Many of you may be familiar with Tai Chi, but Qigong is more of an ancient primordial practice from which Tai Chi descended. And it includes movement, meditation, breath, self-massage. Many aspects of the Qigong practice go beyond just what you see in the physical, but there are also philosophies tied to it and breath practice tied to it, and five-element understandings out of traditional Chinese medicine and foods and seasons and many other things that are part of the teaching. But what we usually see up front is what looks like some sorts of movement with a meditation and breath focus. And then Tai Chi is a type of Qigong, and it's much more programmatic in the series of movements that are choreographed, and those Qigong-like movements are then transitioned into much more complicated sets, and frankly usually takes people a lot longer to learn because they're moving their feet around in dance-like steps, and usually they spend a lot of time, weeks, months, years, before they feel like they can really, now I've got the flow. Whereas when we teach Qigong, we're usually able to get people to feel the flow right away. So here's some examples of what Qigong might look like. And here's some examples of what Tai Chi looks like, not that much difference. And put it together, and what have you got? You've got this thing that the Institute of Integral Qigong and Tai Chi came up with over a dozen years ago, called Tai Chi Easy. And Tai Chi Easy combines the Qigong movements, which are simpler, often a little more symmetrical, and the Tai Chi movements, and brings them together, having the Tai Chi movement simplified and repeated so that the movement, the meditation, the breath, and self-massage are all in this package. The Qigong is primarily out of a tradition called Buzhong Qigong, which is called the Vitality Method, and then the Tai Chi is the single movements repeated, so they're very, very easy to learn. And in that work, there was a process of developing standardized versions of it, training people to be Tai Chi Easy practice leaders across the country. And as part of that group, we even did an early dissemination study that allowed us to look at how does it work when you start lowering the bar for what it takes to be trained and just sharing this very, very simple practice. You can see in this photograph here there's actually 50+ people in this room that were engaging in a Tai Chi Easy practice leader session that incorporated these very simple movements and teaching them to people who were community-based organization teachers and leaders and people involved in sharing the practice across many types of organizations in Arizona several years ago. And we've been able to bring this down to the level of getting hundreds and hundreds of people learning how to practice this without having to go to the grandmaster who's trained for 8 years in the cave in China and learning Qigong. So in those early years of working with Dr. Janka, we talked a lot about how to standardize without making the program too boring and not splitting things up so much so that this is only Tai Chi Easy and there's nothing else in the world like it. So if we do research on it, we cannot generalize it all, and develop the idea that meditative movement might be considered as a category of exercise. Now, it also includes yoga, but when you look at the definition of a practice that includes body movement or posture and a clearing of the mind such that one achieves a meditative state, and then a focus on the breath to achieve a very deep state of relaxation, you can imagine that you can include a lot more practices in that, and we're starting to push for looking at making more of our meditative movement practices that are tested in our research evaluated for those elements so that we can begin to see across our studies what is working and what are the key ingredients that seem to make it work, rather than saying, well, it's hatha yoga or hot yoga or Tai Chi Chi or Tai Chi Chuan, instead trying to understand across these things what are the key ingredients. And we have a publication on meditative movement as a category of exercise, as well as what I've listed here, developing and validating the meditative movement inventory that we continue to use in all of our research so that we can draw more broad understanding of what is actually the elements that are active. Now I'm going to move forward just for a moment and look at, if back then mostly we thought of Qigong and Tai Chi, and there were plenty of other studies on yoga at that time also, as being for just a certain small number of outcomes. At this point, we have many, many reviews that have been done and lots more research that's been done. And I feel like I stand on the shoulders of many, many others who've gone before, who've done these kinds of reviews. But the most recent and best review, the state of the science on just Tai Chi and Qigong and cancer survivors, was done by Peter Wayne and colleagues, and he looked at 22 studies and showed a significant improvements in fatigue, sleep disturbance, depression, and quality of life. And that to me is pretty profound, that we've moved this far in the field, that we can say this much is already established the evidence for improvements in those across cancers in the various cancer types in cancer survivors. Pain came in as a close contender, but one of the things we often find is that people who enroll in these studies as survivors may or may not be experiencing pain, so I'm actually not surprised to see that we didn't see a significant change in pain, although it was in the direction that we would expect. And so back to a decade or so ago, I designed a study and got funded to look at Qigong and Tai Chi Easy as a combined practice for fatigued breast cancer survivors. We developed a 2-arm randomized controlled trial to test the effects of Qigong Tai Chi Easy compared to sham Qigong, and that piece was developed by looking at the selected exercises that we were using in our protocol for Qigong Tai Chi, and then picking out movements and exercises that were more like some stretching, some just gentle flowing movements, but using movements that were very similar, but then teaching them without any of the focus on the meditative practice or the use of the breath to create a sense of flow. We sanitized it, so it was focusing more of the mind on getting the correct position or counting the numbers of movements, correct placement of your body, and keeping people kind of out of that meditative state. And we did check that. That was one of the things that was meant to be done with that early study. We worked with postmenopausal fatigued breast cancer survivors. Eligibility included age 40 to 75, stage 0 to 3, 6 months to 5 years past treatment. And I know it's, we get asked about this all the time. How did you you blinded people? The study condition was considered to be joining a study where you were either going to be in a rejuvenating movement group that did X or a rejuvenating movement group that did Y, and we're just testing to see which one might work best. So people didn't know whether they were in the preferred intervention or not. And we also made sure not to include language around, anything that would trigger them to say, is this Qigong? Is this Tai Chi? So no yin-yang discussion, no qi language in the teaching. And we used 12 weeks of classes. Over the 12 weeks, there was a once-a-week class, but we also encouraged most days per week, please include some home practice, and we had them log all of that. And there were measures taken before and after, and 3 months follow-up on the outcomes that we were interested in, which included we had measures of self-report, including fatigue, using the fatigue symptom inventory, sleep quality, using the Pittsburgh Sleep Quality Index, depression was the Beck, quality of life was the medical outcome survey, short form 36, and then we used the FACT-COG for measuring self-report of cognitive function. But we also had an objective measure, the Wechsler Adult Intelligence Assessment for Cognitive Performance. We used 2 small evaluations for that. Body mass index, waist to hip ratio. We also looked at heart rate variability, a parameter within HRV called coherence. And then we measured, as a process control as well, physical activity overall to see if people in one or the other group were increasing or changing their physical activity during the course of the study and also before and after. And then we had logs to look at their Qigong Tai Chi adherence. So in that study, we were able to get 87 to complete, Qigong 42, sham, Qigong 45. The age was, mean age was 58.8. We worked at it, but in the area, the hospital that we were recruiting primarily from was in a predominantly white area in Arizona, and had only been able to recruit 3 Asian American, 2 African American, 2 Latina participants. BMI average 26.8, so leaning on the heavy side. And they all were, we were recruiting, and they had to be a certain degree of fatigue to be eligible, but we found that at baseline we still had, high correlations among the fatigue, depression, and sleep deprived. So most of our participants had all 3 of those pretty critically at the beginning. So one of the things we really wanted to do in this pilot study was take a look at how our sham control was working and to see that we could create parallel conditions. And there were no differences in the placebo-oriented factors, that is perception, that what they were doing was like Tai Chi or like Qigong. We actually asked that at the end, and we got about equal perception of that. Belief that CAM, or complementary alternative medicine, is worthwhile in case they were suspicious there was something a little complementary about this, and that might have biased their thinking about their experience, and the perception that the movements were gentle flowing motions. So we had a very, very similar type of movement going on in both interventions, and they were similar. We also had very similar, no significant differences between groups in the minutes of exercise practiced, just over 1,000 minutes, which is a bit over 80 minutes per week practicing in both groups, and intensity, the perception of intensity of exercise, lower than 10 on the Borg scale, which is very light. And we did do a side study with a different population to look at the intensity of this Tai Chi Easy practice, and it's basically very low intensity when we measure it using a metabolic cart, about equivalent to taking a nap. So we're looking at a very, very low level of exertion exercise here. Our primary outcome as fatigue, yay, we actually achieved a significant difference between the intervention and control. The Qigong group went from 4.6 down to 2.1, and this is on the fatigue symptom inventory scale that ranges from 1 to 5, and 3 is actually considered a clinically meaningful level of fatigue, and we were able to bring people from above that to quite a bit below that. The sleep and depression, there were no significant differences between the study arms. Both improved over time in the direction expected. Exploratory outcomes. We ended up publishing these additional factors a little bit later in a separate paper, but we got significant improvements over time in both study arms for cognitive function and performance. That was both the self-report and the objective measures of cognitive function, and the physical and mental health when you break down the medical outcome survey into the two components, and overall physical activity increased for both groups over time. Remember, these are very gentle exercises, and to get this kind of improvement for both of them starts giving us a second thought about the usual thinking around physical activity needing to be at a certain level of intensity for it to have an effect. But here's where we got the difference, the significant difference between the groups in the reduction of body mass index. So we got a very slight increase in the sham control over time, which is very typical of breast cancer survivors. They tend to continue to gain weight slowly but surely. And we got a reduction in BMI in the Qigong group. And that's something that continues to intrigue and inspire me, and we've done a lot of work on this and trying to understand more about it since that time. But to be fair, and we do describe this more in detail in the paper, we didn't start out by looking at weight or BMI in the beginning of the study. We had a couple of small cohorts of women coming in, and the Qigong group saying things like, it happened several times. We had women coming in saying, I'm losing weight, like, is that right? And so we got interested in it and made sure that we looked at it before and after. So we ended up, instead of all 87, we had 57 that we were able to look at before and after and look at this reduction in both the Qigong and the Tai Chi group. And so, like I said, I've continued to be interested in this issue of how and why might something that is about equivalent to taking a nap in terms of exertion might make a difference in weight. And we do continue to focus on this. There have been, since that time that we first had that finding, there's been a lot more focus in the NCI on looking at ways that we might help cancer survivors who are overweight look at reducing their weight. And over 2/3 of breast cancer patients are overweight or obese when diagnosed. And we've seen all along that physical activity levels decline after diagnosis, and with a greater decline among women who are treated with chemotherapy and radiation, or those who are obese. You can imagine this whole cluster of problems with sleep, problems with fatigue, all working together to make it worse. The overweighted obesity diagnosis and later weight gain then lead to the reductions in physical activity, but also add to the risk of recurrence and all-cause mortality. And this is why it is of such concern. So, as a result of our findings in the study, I began exploring with a transdisciplinary team more about how and why meditative movement might work and might make a difference in weight loss, and published a paper together that looks at things that we found in the literature that might help make that argument, and made the argument primarily for breast cancer survivors. But if you look at this slide and what we created as the model, you could use that for just about, for humans. It's just one of the things that we can look at that makes a difference for people who are dealing with weight issues and body composition issues. So we went back to our study and looked a little bit more at some of the things that we did measure, nowhere near as much as what's on that model. As you can see, we looked at many physiological as well as psychological factors. In our study originally, we didn't have all of that measured, but we did look at level of exercise exertion. We looked at total minutes practiced. We looked at pain. We looked at an overall rating of sleep, and we included in a analysis model things having to do with emotional distress as well, and that's one of the factors that didn't show up working in the model, but we did see that these other factors were significantly represented in the model, explaining why we might get a reduction in BMI. And so I consider this just, we haven't even published, it's just kind of a minimal model, seeing what we could get out of what had not been proposed in our original study, but again, giving us more interest in looking at how and why this kind of practice might work. And so we moved on to a next study that we began 3 years ago. It is initially funded to look at very much the same kinds of things that we looked at in the original study, but with some differences in the design. And then at the same time, we were continuing to look for, look at ways to fund a study that would primarily be focused on the weight loss issues, and have not received funding on that, but we just plugged in a lot of those measures into this study, so it's not required that they're overweight to start with, but many of them are. So in this study, we went for a 3-group randomized controlled trial, and it is designed to test the effects of Qigong and Tai Chi compared to a sham control, very similar, but we added on an educational support group, and this was to have an inactive group. So if we get out of the business of doing some kind of physical movement and are only doing education and support, how might that work? And then since all 3 groups may have a certain degree of social support inherent in the gathering of people together for these classes, we're measuring that to see if we needed that as a control. So it's, again, fatigued breast cancer survivors. We raised the age a little bit for the lower end. They're blinded to study condition again. This time they get 8 weeks of class. We had found that even though we had pretty decent adherence, that the adherence tended to drop off in the 12-week study, and yet for the amount of time that they were practicing, we figured we could get as much with 8 weeks. And then we have measures that are taken before, after, and then 6 months follow-up to give it a little bit more time afterwards. And this time added on some biomarkers that are really designed to look at things that we know have been shown to be related to fatigue with breast cancer survivors, as well as things that have been seen as potentially affected by meditative movement practices. And so these were our biomarkers that we chose. Just a quick aside, the last thing that we added on to really be sure that we emphasize this is here we are living in Arizona. Now we have an opportunity to do a multi-site study where we can go all over the valley, and so we have Spanish classes available, and we're working to over-recruit Latina women into the study, and a proportion of those here in Arizona are going to be monolingual Spanish speakers, and so that's why we've emphasized that as well. I want you to notice up here on the screen, I have our phone number for the study, I have our email address for the study. If any of you happen to be in the Arizona area and either yourself or know somebody who might be appropriate for this study, please, please, please get in touch. We're allowed to do the advertisement for our studies, right? We're always up for recruitment. So now I'm going to get for a few moments into what really is interesting me and continues to hold my attention here is, you know that about a decade or so ago, we were starting to see more and more requests for, especially in the complementary and alternative medicine area, integrative health area, what are the mechanisms? You know, not only does this stuff work, but why and how are they working? And so I continue to be intrigued with mechanisms. The first one has been done quite a bit now with mind, body, and meditative movement, looking at a state of deep relaxation as perhaps being responsible for a lot of what happens and what changes, the stress reduction model. And so there's plenty out there that's beginning to look at that. And it's still, the question is, just because you're relaxed, just because you're taking slow, deep breaths, how does that get into the body? How does that get into the cells? And I don't know that we fully understand that yet, but we're working at it through looking at some of these more specific things. The other one that is probably just not addressed very much, because we struggle with it in trying to understand it from a Western medical point of view, is what the heck is going on here from a Chinese medicine point of view? It's supposed to be all about Qi alignment, balancing the elements. And if you look at acupuncture meridian charts, it's all about getting those lines to run in the direction and to be open. And we just don't have a lot of good research around how and why that might work. But I'm fascinated by that. Instead, I have defaulted to go to some of the more Western medicine-oriented things that we can measure and have good ways to assess. Biological, that would be inflammation, immune balance, stress and cortisol, circadian rhythms, things that may be more biological in nature. And that is something we will continue to pursue in the research that I'm doing, as we are with the study that we right now have undergoing. Neurophysiological has been mostly studied in the field of meditation, because most of the work that's being done is trying to understand more about what is happening in the brain during meditative practice, and is there a way that we can connect those things that are actively happening in the brain or quieting in the brain to what happens physiologically and what happens in the the biochemistry of the body. I've chosen instead to look more at something that is not always thought of as a neurophysiological measure, but I'm really intrigued with heart rate variability. We've been looking at heart rate variability for a number of years now and have a few outcomes that we've been able to see, and just starting to get a better picture of this. But I do find that because the field in and of itself has so many different theories and different ways that it's looked at, including how is the vagal response responsible for what's happening in the heart, how does that interact with the brain, what's the role of the baroreceptors. There are just many, many different ways that this is looked at. And the one that I've settled on that I'm most intrigued with, and it's definitely the most complicated one, is called the polyvagal theory. And whenever I try to voice text that phrase, it comes out polyvagal theory, which evokes a nice image for me, but it's the polyvagal theory having to do with the vagus nerve and incorporating a lot of things that have to do with our social environment and our emotions as well. And I like that the theory has included many of these things, because we take a lot of these things into account when we're teaching meditation, not just slow down, get relaxed, but what does it take in terms of your emotional state? And we're looking at that as part of our research now. I've got one very small study that is incorporating just a single exposure to a Qigong practice for an hour, and then looking at the heart rate variability changes, as well as the potential for that experience to produce oxytocin in the short term. So we have several things that we're looking at related to that. So just a quick review of some of our early results. I'd mentioned that we've been measuring it all along. It's kind of like whenever you make it, I think many of you have experienced this if you're academics and you're doing research, you very slowly can move a tentacle out in a particular direction. I've been spending a number of years now just really learning about and following the literature and collecting some data, and we're at the point now where we can begin to understand well enough within our team, collecting experts around me in this field. We're beginning to understand more about heart rate variability and just beginning to form some of our early thinking on how we might propose this and work with it in the future. But in our pilot study with breast cancer survivors, the early one, we did see that this parameter called heart rate variability coherence, which is correlated with vagal tone. It's also very similar in its measurement and assessment to what's called resonant frequency, that the HRV coherence is higher in the Tai Chi group compared to the Shan Qigong group from pre to post. And we also see that the heart rate variability increases in association with improvements in sleep and depression. There's a lot in the literature about heart rate variability having associations with, well, first, long-term longevity, just simply better heart rate variability is associated with better health outcomes in general. But we're beginning to see more and more smaller studies that are looking at how heart rate variability changes can make a difference, or improvements can make a difference even in some of the biochemical markers that we often check. So inflammatory markers, et cetera. We did a small study, Dr. Rebecca Lee and I did a small study looking at Latin dance and Tai Chi, Qigong as a pilot study. We got very few participants, but we just did this on a shoestring. And we saw in our study our primary outcomes were decreased body fat percentage and seeing if our Latin dance and our Tai Chi could increase their physical activity overall. And we did see that. That was a significant result with a very tiny N. And we also saw that higher heart rate variability coherence was associated with mindful eating. So we're beginning to get at some of the things that are related to our larger model of how meditative movement might have an impact on weight, as well as beginning to see very specific relationships with some of these items. We have one other thing that I didn't get up on the slide here in this physical activity for healthy weight. That's the Latin dance study. At baseline, when people were, we measure heart rate variability in a number of ways, but one of the things you do is sort of get a baseline. What happens when you're just not trying to do anything? Like we ask them to sit at, imagine you're just sitting at a bus, at a bus stop. You're not doing anything, you're not thinking about anything, you're not trying to do anything. And we saw that the no intent, that would be sitting at the bus, heart rate variability assessments compared to a breath-focused meditative state where they attempt to do that, at baseline, there were just no differences. People couldn't go into that state very effectively. But after 8 weeks of the Qigong experience, then we saw that participants were able to significantly shift from no coherence to coherence when they attempted that meditative state. And so it seems that as they're learning this practice, it's translating also then into improving their ability to go to a meditative state. I've just got one more quick slide I want to share that is where we want to go initially with this heart rate variability work, and that is to see if we can get clearer results around just getting that mechanism to be effective. So phase one, we're hoping to look at testing the Tai Chi Qigong effects on heart rate variability. Just can we get that to happen? And looking at how physical activity or social connection may mediate that. And then if we get a strong effect there, then we want to go ahead and look more at other factors that are associated, usually associated with it, and see if we get these outcomes as expected. And I'm becoming more and more interested with some of the colleagues I'm working with in cardiometabolic risk factors, so we'll take a look at how that might work. So I want to just take this down to the bottom line here. Looks like gentle exercise. This is kind of a surprise for us, that gentle exercise in and of itself can work for a lot of persistent symptoms of survivors, and that the meditative movement practice may have an advantage for certain things, especially the fatigue, getting people off the couch, and especially the BMI factor. And then there is growing evidence that heart rate variability may be a mechanism underlying some of the biological, social, and emotional improvements. I know that there's so many ways to go to say, what is the core thing here? What is the thing that's going to make a difference? And people have pinned it on the deep relaxation state. People have pinned it on, can we reduce inflammation, and then that's the thing that makes everything else better. And all of those things I think are really important core places to start, but I'm really hoping that we can do something to contribute to our understanding of how changing heart rate variability through various practices, maybe even, we've been checking it even in some of the storytelling work that I do. Storytelling is a therapeutic intervention. How does that affect your heart rate variability and shift you more to vagal dominance? So these are all areas that I'm looking at working on in the future, including the physical activity for, or the meditative movement for weight loss, and taking down the alarm signals and creating more social safety. And we have been funded over many years, first from NCAM, then NCCIH, Office of Women's Health, and the National Cancer Institute. And I put some of my co-investigators up here. Research staff have been, take 3 or 4 slides, so I just picked out a few of our key senior research staff and thank them roundly for their work. And I am open for questions.
Dr. Larkey, thank you so much. Really interesting presentation. We so seldom have the opportunity to do blinded interventions in our field, so it's nice to see a nice example of that being done, because it so seldom happens, and also the continued efforts toward looking at the underlying mechanisms by which those interventions and isolating the aspects of those interventions have on the sort of positive influences on health that you're looking for here. So really nice work that's being done. I'm going to turn this over to Bill Elwood, who's going to moderate. I think we already have some questions on the screen, and we'll work from those. So Bill, take it away.
I sure will. Thank you, Bill, and thank you, Linda.
Thank you,
let
Bill.
me follow. Oh, no, thank you, Linda.
Thank you, Bill, and thank you, Bill.
Were you saying on your last slide that there could be some elements of mindfulness in storytelling that could be similar to the same kind of, could be similar to the mindfulness benefits associated with Qigong?
In my wildest imagination, yes. Right now we don't have the data. We are looking at it. We have, actually, I'm working with a colleague, Sunny Kim, and she's taken on a lot of the work around storytelling, and we're looking at it as a therapeutic intervention, exposing cancer patients to stories that have some similar challenges and overcoming those challenges that they themselves are meeting, and looking at the heart rate variability during the stories as well as before and after. And we have only got a little bit of data at this point. It's not, we don't even want to look at it until we have enough. You know how we're not supposed to start opening up we're not supposed to go to read the last chapter in the book until we get there.
Gotcha.
So I cannot say that we have that evidence. What we are saying is that we have models of saying that we believe that that might be happening. We do see that the storytelling work, even though, and some of the work Sunny's been doing is with bone marrow transplant folks, the patients, it's a very, very, it's an intense, high burden stress level that people go into their bone marrow transplant experience with, and she has seen changes in emotional status being exposed to stories of other bone marrow transplant patients, but we haven't been able to see this result yet on the heart rate variability. We hope to.
Oh, okay, well, that certainly fits with the narrative paradigm, and Kenzie Cameron's on the phone, so symbolic convergence theory, but we can talk about that offline. I'll go to our attendees' questions, and the first one that came in is, which Tai Chi form did you combine with overall Qigong exercises?
So the Tai Chi movements that I recognize that Roger Yonka has pulled into this form are very similar to Yang style. And I know that because I do a long form of Yang, and, you know, when we say harmonizing yin-yang, the horse's mane, these are all part of the Yang style. I think some of the other styles include some movements. There's a lot of crossover, and so I can't say which in particular. But, you know, Tai Chi, even though it has some centralizing forces around the different families, the Yang, the Chen, the Wu, each of these have very specific patterns that they follow, but there's hundreds beyond that have adapted. And then just a note, in this country and in our research, most of the Tai Chi that is done, not all, but most of the Tai Chi that is done has been simplified. So you take a practice like Michael Irwin is working with, Tai Chi Chi is very simple movements repeated over and over. And when you do that, it becomes quicker and easier to learn, easier to get into that meditative state right away because you're not trying to figure out where to put your foot next. But it's also much more like Qigong, where the practice is very simple to learn and repeated.
Okay, that leads very nicely into the next question we received is yoga considered to be a meditative movement practice? And if so, how do the effects of yoga differ from the effects of Tai Chi Easy?
When I look at the literature on yoga, we are light years ahead. There are many, many more studies that have been done with yoga. Say if we just took one category, like cancer survivors, there have been many more studies done. But you look at the studies, and many of the factors are very similar, the things that are coming out. I'm not as well acquainted with the systematic reviews of the yoga studies, but the ones that I've perused mostly come up with very similar kinds of results. And what we don't know is it because it's the same sort of thing? Many of the yoga practices that I've been exposed to, and I work with a colleague who does a lot of work with yoga and fatigue and cancer patients, as well as other, Dr. Jennifer Huberty, other emotionally challenging situations in life, like stillbirth, for mothers who've experienced stillbirth. And we see that yoga is often a bit more exertive than our very gentle, taking a nap, Tai Chi easy kind of protocol. But then you'll see other Tai Chi protocols that are more moderate in their intensity. So I kind of went off on a tangent here, but yes, we consider yoga to be a meditative movement practice. I would like to see more of our yoga and Tai Chi and Qigong studies measuring that. You know, how much did you feel like you really went into a meditative state? How much did you feel like you were focusing in on your breath? But in the end, I'm finding that most of our studies don't report those kinds of things. They just assume that if you tell somebody what the practice is, and it has a name, and they give a few examples of the exercises, that you've got what you need. So I'm not sure if I answered your question there, but yes, it's a meditative movement exercise, and yes, some very similar outcomes.
Nice job. You have obviously a great ability to enroll and retain patients at this difficult, you know, as they're coming out of chemotherapy. Are there any non-proprietary practices you might recommend to the general public that you attribute your success to?
To the public about recruitment? I'm sorry, I'm not understanding what.
What techniques would you? How do you attribute your ability to, or to what do you attribute your ability to enroll and retain patients through this long period of time?
Okay, two things. One is we have fought and fought and fought to learn how to do this, and in the study we're doing now, we're still fighting. It is very difficult. We do everything from going directly to the providers who care for these patients, both in the oncology setting as well as in primary care settings. We go to every community site that we can possibly think of. We have people in our staff who have connected with the kinds of places that you wouldn't necessarily think you'd find breast cancer survivors, but you go out in the community and they know somebody who knows somebody who knows somebody. And so it could be anywhere from churches to a place that feeds the homeless to places where they provide education on other things not having to do with health. It has been massively challenging. So the recruitment side has been a lot of work. I don't have good ways to say what works the best. Getting one or two really good champions in a particular organization sometimes really helps. But the retention side, we have just found that once people get engaged, we've done, you know, I'll say this because it's happened to me many times. I often come up with such an incredibly wonderful control group or sets of controls that people love being in those as well as in the primary practice that we're testing. And so I think that there's something in our interventions that draw people and that keep people, because we have wonderful instructors who have warm, caring personalities. We choose for that, and that the way that we teach keeps people wanting to come back. It's an addictive thing that we try to create. So retention hasn't been as much of a trouble. Recruitment is very challenging.
Okay, Gewalt.
We got
a couple questions about your control group. Speaking of how enjoyable it is, how did you come? How did you come to call it a rejuvenating movement?
Made stuff up? I don't know. We kicked around the word.
Well, you know, you reported on the health improvements in the rejuvenation group, and a couple of people have asked about that because does the term rejuvenation itself perhaps lead the control group members into optimistic bias?
Yeah, and so that could be possible. You saw the list of things that we tried to control for. You know, did you think that it would be better? Did you? I think there was one that wasn't specifically geared. I only gave you 3 of the examples of perceptions. I'd have to go back and look, but I think one of ours is just simply, did you expect that this would be, you know, that this would work? And there were no differences between the groups, which is kind of what you want to create. I mean, if you want to test it fairly, you're saying that you want to create an equal amount of hope and expectation and high or low. And if we did that across groups, then any difference we see between the group would be due to the intervention more likely, as opposed to due to some expectation. And so, yeah, we might have created a, wow, I'm in the rejuvenating movement group, you know, and they did better because they expected it. But then we saw a couple of things that, you know, this small number, we saw a couple of things that we did get significantly different. And in this study that we're doing now, we hope to see that we can get more of that kind of difference, especially having an inactive control. So there are lots of things about control groups that can be controversial. But I'm happy with what we did there in creating that.
That was a, go ahead. That was a really thoughtful response. Thank you so much.
Mm-hmm.
The next question, I think, talks to your slides, is many of your photos were taken outdoors. Do the classes in your research occur outdoors?
Most of them do not. You've got some photos that are, you know, there were some that are thrown in from some of our Tai Chi Easy Practice Leader training. There's some that are of me, and those were easy to get without having to, you know, write back to the person and get them permitted. But
okay.
Yeah, no, we usually don't. I just did like we often have weather that's too awful, or I try to as much as we can, but we mostly cannot do that.
Okay, because we had a question as to your thoughts as whether practicing indoor or outdoors would have an additional influence on health outcomes.
I absolutely have some opinions on that, but here's the first answer is outdoors is really the way that Qigong is designed to be practiced, and many people feel the same way that work with the Tai Chi practices. Getting your feet barefoot on the ground, on the earth, is considered to be part of the benefit, part of what brings the benefit. So yes, we've lost a little bit of the fidelity in that we're moving inside. But the other aspect that is taught with, particularly with the Qigong practices, is that there are expectations that as you use your imagination to create a sense of connection with the earth, a sense of connection with living things around you, an experience of taking in the energies from the sky and the heavens above, that it is the imagination that does some of the things that we say happen in Qigong. And so even in Qigong practice, we say, well, if you can't go outdoors, imagine you're outdoors. And I know that sounds very unscientific, but I would ask you to think about what happens when you're watching a high-speed chase on a movie, and that engagement that you have with your mind, with your imagination, creates biochemical changes for you. And so whether it is imagining that you're soaking up the light that's filtered through the green leaves actually makes a difference in a very specific way around green leaves, or it just helps you to breathe in and experience and imagining that you're in nature, which we do know has some effects, that we're getting some of that, and that's how we teach it.
Very nice, thank you. This next question comes from a mutual scholar and friend, and also immediate past presenter in our seminar series, Kenzie Cameron, who says, thanks for your presentation, Linda. As you begin to find these positive outcomes, have your thoughts turned to future dissemination? Specifically, given your great demonstrated ability to essentially train the trainer, where do you perceive key outlets for dissemination may be, or even, as some of us say in the D&I field, de-implementation?
Yes, yes. Thank you, Kenzie. Nice to hear from you. And yes, I've thought about it. You know, when I look at this practice that we have, and it's standardized, and it's so easy to teach, and boy, we could probably do something with one of those dissemination applications. We've been talking about it, I'm considering it, and there's a part of me that keeps wanting to go back into the lab. Instead of going big, I'm going smaller right now. Some of my areas of interest are taking me down to, you know, these microbiological levels. We've got one postdoctoral fellow in Pomona, California, who's working with cancer patients with this practice and looking at genomic markers in response to this. So there's a part of me that's going very small as well. But yes, somebody needs to walk into my life and join me as a partner in doing this. I know that eventually we'll do this. We've got a good body of evidence, and we've got a good standardized program that could be disseminated. So yes, I'm thinking about it.
Okay, thanks. Unfortunately, we have more questions than we do have time, but I've got a really important question. If a patient with another type of cancer who is also in Phoenix is interested in learning Tai Chi Easy, do you have a recommendation for this person and people like them?
Yeah, so there actually, if you go online to the Institute of Integral Qigong and Tai Chi, IIQTC, there's a list of instructors that you can find in the local area. We've got some really great people teaching, Deanne Hodgins, Roxanne Reynolds, Dina Vu. They're people who teach this practice through Arizona, and I know that there's some in Tucson as well, and you can find their names there. If you've run into trouble, you are welcome to contact me through linda.larkey@asu.edu, and I can give you a little bit more help with finding that.
Okay, great. Thank you so much. We'll follow up personally with the offline on the remaining questions. Dr. Riley?
Thank you, sir. Linda, thank you again for the presentation. It was very nicely done. I'll just let people know before we end, our webinar next month on June 19th at 2 p.m. will be on targeting cognitive and effective processes in behavioral development research. Our guest speakers then will be Greg Siegel at the University of Pittsburgh, and Ariel Baskin-Summers at Yale University. So this concludes today's webinar. Thank you all for your attendance. Linda, thank you again.
Thank you so much.
Okay. Goodbye, everyone. Thank you.
Bye.